Hi, I'm Grown-Haeberli, and I'm here to give you a crash course in Women in Relationships. Women in Relationships aims to cover all of the challenges, opportunities, and next steps that we, as young women, will face in the world. As a religion class, prayer is of course how we start out every day. This semester, we focused on women. Feminism, female strength, and equality especially were key themes. We start off with an opening, such as ringing the prayer bell, and then declare the theme of the prayer. Next, there is a reading relevant to the prayer theme, and then a reflection involving the class. We end with intentions and finally a closing, ringing the bell again. Prayer centers us, allowing us to focus our minds on what we will be doing for the next 80 minutes. Much of the Women in Relationships course revolves around the topics presented by Ophelia Speaks. Friends, families, brokenness, mind, wounds, strength, body image, and relationships are all covered. The Friends presentation covers support, growing apart, and the shift of relationships accompanied with death of a friend. The Family presentation speaks about the struggle of non-traditional families, such as single parents or homosexual households, the autonomy struggle in a mother-daughter relationship, and the emotional connection between father and daughter, as well as sibling rivalry and affection. Brokenness. We are all broken. Brokenness can appear as a result of divorce, separation, or neglect, after violations such as abuse, or as a result of grief, especially as caused by death. The Mind presentation puts forward the reality we all know. Academic pressures can lead to mental health disorders such as depression or eating disorders, or to cheating. It's perfectly reasonable to not be perfect, but sometimes this realization comes only with therapy, support, and proper management. Wounds are both internal and external, says the Wounds presentation. Self-inflicted wounds such as self-harm or suicide are normally hidden and are hard to recover from, but they can be recovered from. Substance abuse causes 88,000 deaths annually and is a large problem where there is no line drawn. And rape and sexual abuse leave people feeling violated. The strength to recover from these wounds is there in everyone. It just has to be found. Strength discovers topics like prejudice, cultural identity, gender equality, and interracial relationships. Faith provides strength, a well of bravery to draw from. It is important that we stand up against what beats us down, taking part in civil rights movements and feminism. Body image is an important presentation. We cover the thin models that the media portray as having the perfect body, the eating disorders which girls develop in response to these unachievable images, and the self-esteem loss which girls undergo in relation to body image. Finally, the relationships presentations cover crushes as infatuation, the normal fantasies of teenage years including a happy relationship, sexual orientation, homosexuality versus heterosexuality and coming out, gender identity, and the stigma surrounding women and sex, as well as manipulation and betrayal within a relationship, the commonplacity of teen pregnancy, the horrors of dating violence, the stereotypical gender roles within a relationship, and first love and the heartbreak associated with it. The discernment unit starts off with vocations. Vocation means a call to a particular state or way of life, and discernment is the process of discovering your call through prayer, reflection, and discussion. A person can be called to the church, to married life, or even to laity. Through reflection and looking to the future, we work to discover which college we want to go to, what we want to major in, and what our future career will be. We discern to be happy, be whole, find our purpose in life, and our calling. The Selfie Project, by cataloging what we are grateful for and what challenged us, helped us discern. In our adult life unit, we realized that all the other topics in women in relationships fall under adult life. Finances are a large part of this. To help us understand that with great power comes great responsibility, we put together a budget balancing monthly fees, potential student loans, and potential income. A major topic this year was sexuality. We kicked off the unit with sexually transmitted infections. Gonorrhea and chlamydia are both bacterial infections of the genital area. Syphilis is an infection which starts in the genitals and can spread throughout the body. Trichomonas is a protozoan infection. Human papillomavirus is a viral infection of the genital area resulting in genital warts. Genital herpes is a viral infection leading to cold sores, whereas hepatitis B targets and attacks the liver. And human immunodeficiency virus is passed on through fluids and attacks the immune system. For gynecology, we covered the process of a pelvic exam. A pap smear is important to detect STIs and possible cancers, especially when becoming sexually active. This is a very important routine health procedure. Birth control, the next topic, covers the pill, shots of Depo and Lunel, patch, which all stop the ovaries from releasing an egg, abstinence, and condoms, which prevent sperm from entering the vagina. Every person has a sexual orientation, the inborn tendency to experience attraction towards certain gender or both genders. The vast majority of homosexuals are not homosexual by choice and therefore not obligated to change their orientation. Of course, birth control doesn't always work. Conception occurs when the sperm travels up the vagina, through the uterus and fallopian tube, and one sperm enters the egg. Attached to the uterus wall, the fertilized egg grows and develops. After 40 weeks, the cervix begins expanding and the baby is born. Abortion is the removal of the baby from the womb before birth and can occur at any trimester, though vastly differently. The grief cycle involves 5 stages: denial, anger, depression, bargaining, and acceptance. Denial helps pace the feelings of grief. Anger is the first emotion felt, and the emotion we are best at managing. This is caused by pain. Depression presents empty feelings, the realization that the person is truly gone. Bargaining is a stage in which you ponder the if-onlys, accepting all the blame. And finally, acceptance that the person is gone and that this reality is now perhaps pained but permanent. Grief is a part of life, a natural process associated with dying. Speakers are an integral part of the Women in Relationships course. From Erin Baduch's speech on healthy versus unhealthy relationships to the marriage panel covering the lifelong and faithful love which establishes the covenant of marriage, to Mrs. Ewell and Ms. Searles about wellness. Kim Clark Faith spoke about reconciliation to the church from members of the LGBT community, and Belle wrapped up the course by presenting her wonderful story of living through hard relationships, pregnancy, substance abuse, abortion. You name it, she's experienced it. Our year was wrapped up with wellness. Through the Cube meditation, we established who we are in relationships. We practiced setting boundaries, where we are okay and not okay, and we established our independence. Discussing go-to friends and relationship fit provided something everyone could relate to. We've had a very productive year in women and relationships.